Hi, this is my indwelling female catheter video as well as respiratory assessment and abdominal assessment. So I'm going to come into the patient's room, hand hygiene, close the curtain to provide my privacy, come in and introduce myself and identify the patient. Hi, Ms. Jones. I'm Samantha. I'm going to be your student nurse today. I'm going to check that it is Ms. Jones on her wristband. And we're going to put the bed up, raise her head of the bed, and raise the actual bed. Right up. Ms. Jones, I'm going to perform a respiratory assessment on you. So first I am just going to pull up your gown a little bit and inspect. Going to look for symmetry, make sure that the sternum is in the middle, check for the use of any accessory muscles when she's breathing, and everything looks okay. So then I'm going to lightly palpate for any tenderness or masses. And everything feels okay. I wouldn't have her gown in her face. So then I'm going to auscultate and just listen. Have you take a deep breath, Ms. Jones, and exhale. Listen on one side and then move over to the opposite side in the same spot. Come down, listening and asking her to take deep breaths and exhale.
Mondays or Tuesdays just
Cover him again.
First we
And
have
then open up my sterile field. Throw this in the trash. Then my sterile equipment. This will also be used as my
And everything sounds good. So we're just going to cover up
I don't think they can make
her there, and then we're going to do an abdominal assessment. So first we're going to come in and just inspect the abdomen for any, make sure that the skin is intact and skin's intact, everything. The umbilicus is flat and looks good that the belly is not rotund. And then we're going to auscultate the 4 quadrants. So you're going to listen to each quadrant for about 15 seconds. And you're listening for bowel sounds or lack of bowel sounds. So not really listening for 15 seconds, but everything sounds good. She has bowel sounds in all 4 quadrants. Next we're going to palpate the abdomen, lightly palpate, and we're seeing if she has any tenderness or any masses can be felt, and everything feels good. So since we're going to insert a catheter in her, we're also going to palpate the bladder, and it is distended, which is, indicates that she does indeed need the catheter. So we're just going to cover her up there, and I'm going to set this aside. I'm going to put on clean gloves.
For some reason this thing just wants to flap back.
I had the hardest time getting this email.
And if needed, I would have someone assist me in putting her in the dorsal recumbent position. So I would explain the procedure to her. Ms. Jones, we're going to be inserting a catheter, and I would have checked for allergies to latex or iodine, which she does not have allergies to either of those. So Ms. Jones, I'm just going to uncover bottom portion of you here, and I'm just going to take a wet washcloth that was in warm soapy water.
Center, pick up.
tuck it in like that. We're just going to clean the outside of her labia, always from front to back. Switching sides. Clean that side. And flipping the washcloth around so we have another clean side and clean down her middle. I would put that in the dirty linen and grab a dry washcloth. And we're pretty much going to do the same thing. Dry her off. I'm going to dry one side first, front to back. Switch this around. Dry the other side, front to back.
Without touching it with my dirty hand.
And then dry down the middle. Also placing this in the dirty linen. So then I'm going to remove my clean gloves. Put these in the trash. Cover her up while I get my supplies ready. I'm going to take this kit over to the bedside table.
And there goes my sample.
And my hand hygiene.
Go until there is no more urine coming out.
Pull this out. And then actually use this for my trash.
Let go. Hold and throw this away.
Place that in a convenient location.
Oh, then don another pair of clean gloves. Actually, I'm going
to open this up.
I'm going to pick up all my materials now.
Going to pull out this drape.
Set this on his table without any of his personal belongings there so I can take my measurement later. I will take a clean, soapy washcloth,
And
in a circular motion, again grasping,
somehow
and just going around.
figure out how to. There we go.
Throw it in the laundry.
This is what I want.